Welcome to the Hank Cisco Show, ladies and gentlemen. Don't touch that dial. This is a show that is helpful. We're talking about keeping people healthy. My show is about informing people, whether it's politics, whether it's something to do with food. But now we're going to talk about skin cancer and also breast cancer. Actually, this month is actually breast cancer awareness, okay? In today's Times Herald, a big article on it. And my guest today, well-timed, knowledgeable, likable, and, one of the best around. And you can prove it by right here where the Times Herald has a survey, and they find out that. Now, my guest is Dr. Marlene Mash. Okay, now, you're a dermatologist, right?
That's
but you're a little bit more than that, okay? So tell me you're a surgeon, right? A surgeon along with it, okay?
Right.
Now, and your office is 1000 Germantown Pike in Plymouth Meeting. And I just want to tell people right off the bat, you're going to learn something about some of the problems people have with skin cancer, how you get it and how to treat it. And, but not only did she help you, but she also free skin cancer screening every Tuesday in her office, 1000 Germantown Pike, from 9 a.m. to 11 a.m., okay? And the phone number is 610-277-2663. Give a call, say, look, I want to come over, I want to get a free screening. I got a little problem here, a little problem there, okay? And she'll check it out. So, without further ado, we have Dr. Mash.
Thank you so much, and thank you for having me on the show.
Oh, listen, it's a pleasure. Let me tell you. I want another thing, ladies and gentlemen. A lot of charitable work she does.
Thank you.
She works with the community, and everything that comes out. It's available for her to help out. So, tell me now.
Thank you so much.
Tell me a little something about what is a dermatologist.
What do I do? Now, some people call me a dermatologic surgeon, or you can say a dermasurgeon. Dermasurgeon. That means I do surgery on skin. Derma meaning the skin. So, in my office, I have a lot of information of what I do, and you could pick it up. It's what this doctor does, a dermatologic surgeon does. It's a lot of pages, and I'm going to promise you, I'm only going to read this, and I won't read anything else.
Okay, no reading. Go ahead, hit it.
I will read it, because I want to capture it all.
Right.
So I am a dermatologic surgeon. And what I do is I'm a skin surgery specialist who focuses on the health and beauty of the skin. That's what we're going to talk about today, from head to toe. That means I treat things on the head, the face, and all the way down to the tippy toe.
Toes.
From the cradle to the golden years.
How about from the womb to the tomb?
Right, that one too. And I perform both medically necessary and cosmetic surgery procedures to maintain the health, function, and appearance of your skin.
Okay.
So that says it all, and I'm not going to read any more, but I want to get it all in.
Give me that.
There you go.
Okay, I'll put it over here. Now.
Okay, and if people can't remember that, they can come to my office and pick it up.
Beautiful skin starts here.
Right.
Now let's go with beautiful skin. I've always had a problem with oily skin and all, and so it's one of them things, I guess, because I'm from southern Italy, but oily skin, it protects us from the sun, I guess. That's what they tell me. I don't know what the difference. But I was born in the United States. I was born in Brooklyn.
Right.
Okay.
All right. So we're gonna hit on that oily skin, but can we hit on the skin cancers?
Go ahead. Skin cancer. That's this month, right?
Right. And I thought maybe we want to hit on that because sometimes we run out of time, and I think that's really important.
Right.
Oh, and also you said that that's a good point. October is National Breast Cancer Awareness Month. That's really neat. I should be wearing pink, but sorry. But even a dermatologist, I have picked up cancers of the breast. So if anybody has any problem with any lesions of the breast, especially around the nipple, they shouldn't wait. A lot of people wait until it's too late.
Right, okay.
So very important. I mean, they can come and have free skin cancer screening. And then it'll relieve their mind. Maybe it's nothing. Maybe it's just a little, it's called a little cyst.
Right.
Or it could be something serious. So it's very important to be aware.
When in doubt, check it out.
That's it.
Right.
Absolutely. I like that.
All right.
I
now
like
what
that.
else?
So anyway, We could talk about the skin cancers, and that's very important because there's
too much sun too?
Well, a lot of times it's that, but it also is hereditary.
Oh, yeah?
So if your family members had it, you have a higher chance. If you're blue-eyed, you have blue eyes. Oh. And fair skin, even though you're Shakadan, you're Italian, right?
Yeah, right. Sicilian.
Sicilian, right. So,
we're
but
dark complected.
Yeah, but you still have that kind of the blue-eyed, and you're kind of on the fair side, even though, you know. And you would be, and you are, because I had treated, you remember a couple of years ago, treated little skin cancer. And it was good that you got it because some of those skin cancers can get serious and they can destroy parts of your face.
A lot of golfers get that because they're out in the sun a lot too, you know.
And you know, all these people, they're out there in the sun. And some people, they're out there baking in the sun. And we have tried to tell our teenagers
and
to
you can even get, you don't wear sunglasses, you get sunburn of the eyes.
And in the eye.
Right. I had an eye doctor who told me, I never knew that, you get sunburn of the eyeballs.
Right, yeah, because you know what, you have pigmented cells in the retina. And people are known to get melanoma in the pigment cells of the retina. And that's very serious.
Right.
And the ophthalmologist can pick that up.
Now, now how about your other thing you got here?
All right, so we're going to, let me talk about melanoma because that's a serious one.
That's something very common. Well, it's a lot of people, okay?
Right, and so we have the melanoma you have the warning signs of melanoma, and if I can have that dangerous signs of skin cancer.
Yeah, I think they're going to flash it. They'll be on the flash.
Yeah, but we could talk about it as the first sign. It's A, B, C, and D. Okay, or A. You can give that to me so I could see it. And then, so A is this is like we should have it memorized, but I don't want to forget. So I'm going to look at it too.
I can hold this up like this?
Well, no, I think they have a picture of it on the, so asymmetry is one, that means like if the lesion is asymmetrical, if you draw a line across it, and you won't see symmetrical, you'll see one side different than the other. That means asymmetry. Okay. That's A. B is border irregularity. The borders are not regular. You see a lot of these moles that are, they look scalloped. They're not just regular. And then the color variation. If you have more than one color in the lesion, for example, if you have black and red together, black and brown, that's a sign.
That's a sign.
And then diameter, if it's larger than the pencil eraser, that's actually 6 millimeters. All right? Like that.
Right.
They're the danger signs of melanoma, and you don't want to wait. You want to get checked because the sooner you get...
That's curable, right?
Well, it is if you get it in an early stage.
Okay.
But I have some people, they can't see things on their back. That's why we offer skin cancer screening, because they don't see what's on their back. So they come in and we see, sometimes they come in for one thing, and it's not anything to worry about. Right. But when I check the whole body, do the whole skin exam, I can pick up the melanoma. A lot of times I pick up melanomas and the patient doesn't know they have it. So that's the important one, is that, and then if you have a lot of moles, anybody has a lot of moles. That's
another thing about moles. Oh, you want me to hold this skin?
Well, no.
Oh, okay, go ahead. Go ahead.
And then we have offered, and we're very lucky to have services here, and it's in King of Prussia. I'm just saying that when you have a lot of moles, you want to have a total body photographer take your picture.
They take a picture of the
moles.
They
the whole body. Because when you come back in 6 months from now and you say, doctor, did I have this mole before? I don't remember all the moles. So you get your picture.
It's like a crime scene, right?
Right. So
take a picture.
Right. So that's very good. It's called total body photographer, and we offer that. But we don't offer it in our office, but I offer it to patients, and they can get it done right in King of Prussia. I think that's a really good service.
Good prevention.
And by the way,
and awareness.
Insurances pick it up.
Okay. That's another thing. People are that's another thing. Come in, call in, and find out if you're covered. You know.
Right. Yeah, I take almost every insurance. I definitely take Medicare, and all those health maintenance, Aetna and so forth.
Right.
So I wanted to get the word out about the melanoma because that's very important.
That is a lot of people get that, I guess, right? Is there any
on
prevention or something? It just comes, right?
We have to teach the
young everybody. Is it different nationalities that are more subject to that?
Well, we talked about the blue-eyed, the Celtic, the very fair family history, people who don't care, they still get their skin cancers and they go out and they bathe in the sun. Really, they do. And they go to the tanning booths too. So as a dermatologist, I don't agree with them, and a lot of patients come in and say, what do you think about tanning booths? Well, I don't think that they should be. In some states they are outlawed. So, so it's exposure to the sun, that's very important, not to be in the sun, and to use a good sunscreen. So we can get into that a little bit too.
Right.
Very important.
Now, some people go, they sunscreen, they put it on, then they go in the ocean and they come out, and they should put it back on because it's going to wash away, right?
Absolutely.
They think once they put it on, you know, it's good for the year, I guess. I don't know.
I know.
But
well, yeah.
keep putting it on.
Right. That's right. Especially if you're going swimming, come out, you got to do it again.
Right.
And if you're out there running, you should have something, because some people run for an hour or two or whatever they're doing out there.
Right.
They should reapply it almost every hour, especially if they're sweating.
Right.
That's a good point. I'm glad you brought that up. So that melanoma, that's the one that takes your life away if you don't get it. I mean, it could go into your body,
life-threatening,
into your lungs, into your brain.
Oh,
you
yeah?
know, it's called metastatic.
Hey, everybody paying attention there?
Yeah.
Okay.
So it is good to know, to be aware of that. And they're usually kind of like black, dark brown, reddish. Yeah, and a lot of people think that because it's flat, it's not a skin cancer. That's not true.
No?
There's a lot of flat melanomas. In other words, it's flat. It doesn't have to be raised.
Oh, in other words, don't come up
doesn't
with
have
a
to
big
be
hickey.
a hump. No. And it doesn't have to bleed, and it doesn't have to hurt.
Right.
It doesn't have to itch.
It's there.
Nothing.
You're just waiting for the right time to
and then it
enlarge or
and sometimes it doesn't come up. It goes deeper in the skin, and it goes all around in your body, in your bloodstream. And by the time you find out, it's too late.
It's like a submarine, right?
Yeah, it sinks
up and down.
instead of going up.
Well,
right.
I'm glad you let me know about this stuff. I'm going to tell all my friends, right? Everybody's listening and watching TV.
Right.
All right, now what else?
Well, wait.
I'm going to get everything in this half hour.
See, all right, see the patient information, they're free.
Now you come in your office and they can pick that stuff up.
You get your free skin cancer screening, and you can pick up any information.
And all the people you working in the office, so friendly. As soon as you come in, they're ready to help you, you know, so that's very important.
Thank you.
Right. Well,
I appreciate that. I have a good crew, and I really appreciate it. Yeah, so we talked about malignant melanoma. That's it. That's the deadly one. But these are very common. The basal cell, that's the one, Hank, you had on your cheek.
Right,
you had
right here,
right
yeah.
there, yeah. And
I don't know what, come all of a sudden, I don't know what.
And then I kept telling, but you know, you had time to spare because it's a basal. If it was a melanoma, I would have brought you in the office right away. Basal cell takes time, but it will destroy parts of your nose, your face, and then the squamous cell. These are called non-melanoma. They're not melanomas, but they can. You know,
I've been at Exhibit A here. I had hip replacement. I had my doctor did the hip replacement. I had my cataracts. I had my doctor. He's there. You know, I had the skin take. You know, I got doctors for everything. Even I had my doctor. I had a ingrown toenail. I had him on my show too. So go ahead.
Well, I'm glad you had. No, I'm not glad you had a skin cancer, but I'm glad I'm on your show.
Yeah. Well, hey, and the skin cancer. This whole month is for awareness for
breast cancer.
Breast cancer.
Yeah, and by the way, usually May is National Skin Cancer Awareness.
Men get that too, right? Get breast cancer too.
Yes, of course. Yeah.
Pay attention, men. It's not just a women's show. Go ahead.
All right.
Now, what else?
So you know, to prevent the skin cancers, we all know that, right? That we use the sunscreen.
To get screening, okay.
Screening,
and you get free screening. I'm going to mention it again, okay? Every Tuesday from 9 until 11, okay? And give a call, make a phone call, 610-277-2663. And make a little appointment, go in, boom, check out. When in doubt, check it out. All right, what do we got here? What else? How about warts?
All right, so you know I'm a dermasurgeon, so like I said in the earlier part of the show.
In other words, you're not just going to put medicine on, you're a surgeon.
Once you're diagnosed, I will, but there are some that you don't have to go that far. There's sometimes there are creams and so forth, but so that would be the treatment to take it out. Okay. And then warts are very common, and I treat them. They're very easy to treat.
Is that a big deal? Electric or?
No, lots of times we use what's called liquid nitrogen. It's a little liquid that's very, very cold that we just freeze it right on the wart.
Freeze it.
Right, and then the wart forms, there's a little blister that forms, and the wart falls off within a day or two. And that's very common.
Well,
So
I had a
just-
problem, acne. I think all teenagers get that now. Tell me something about that. What's the scoop on
Well, yeah, acne and acne scarring. See, they didn't have it in your day to treat acne scarring, but I see people like your age, you know, and in the 60s, 70s, they didn't have the treatment that we have today.
Yeah.
If you get it ahead of time, then you don't have the scarring. So that's why I try to tell the parents today, when the kids are starting to scar, you got to get on it right away. You're going to have scarring.
They didn't have it when I started.
Right.
They got scarred.
Right.
But then I was a professional boxer. I was getting hit, so I was making more problems.
So you
know.
couldn't tell the
But that's,
pox
you know,
marks from the...
Well, the good Lord put them on there, and He's going to take them off. So I don't know. Good.
So yeah, there's all kinds of treatments, you know. So
But acne, this is the teenagers. You know, that's a big
well,
thing. You know. That's,
yeah, but it's not only for teenagers. I have people in my office in their 30s, 40s, 50s. And you know, rosacea, I don't know if you know about rosacea, is people don't realize that that's adult acne.
Oh.
So, you know, you don't like to say, you have acne and you're 50 or 60, but it really is adult acne, and we treat it very similar. The rosacea is adult acne. So there's a spectrum from some kids start acne when they're 9 or 10, and then you go all the way, and if you're not treated, you keep, for example, Hank, yourself, the oily skin, you still have the oiliness that you had as a teenager.
Yeah, I thought when I was a teenager, but I've gone all through my life.
Right. So there are treatments.
I don't know. I mean, I guess they put me in a hearse. I'm going to be oily. It's going to slip right into the grave. You know, I'm going to go woo.
Oh gosh. Well, we'll take care of that. We'll give you some nice cleansers for that. We're not going to make it too greasy here. All right. So yeah, we treat that, and then you know, our people have the scarring, so we have all kinds of treatments for that, from lasers to creams and so forth.
Sometimes a laser can scars like straighten that out.
Multiple lasers.
So much
for that.
advanced technology.
Oh, it is.
What's about the latest thing you can think of that you think is?
Well, you know, we can separate it into like the alternative. You know, people don't want to be on pills for acne. They don't want, and we do have lasers that are FDA approved for nodular cystic acne. That's a severe acne. So we have that. We've had that laser now for a couple years. It's a laser for acne, and the kids, the parents love it.
In your office, you do it?
We have that.
Everything's in your office, right?
Yeah. So we have lasers that, and that's really fairly new technology.
Right.
And we're so happy to offer that, because some people want to go into the alternative stuff. They don't want to take the pills. They don't want to take the creams.
And also, you have your daughter works right with you, right?
My daughter, yeah.
What's her
She's
name?
Maria, and she was on the show a couple months back.
We had her last year when we had her on the show, and she's there. Yeah, she's in the office.
Right.
I go walking in there. Hi, everybody. Said, everybody's very.
Yes. So I have another provider too. Beside Maria, I have another person, Deborah Hobrecht. She's very, very good. Because Maria, she made me a grandmom 2 months ago, so now she's taking care of the little bambina.
Mamma mia,
yeah,
right?
Mamma mia, right. So we have providers in there, so if I'm not there, like I'm here now, I have Deborah, she's taking care, and she's very good. So anyway.
Now, let's hear back to this.
You want to talk about?
Go ahead, go ahead.
Yeah, with that big word?
Yeah, I can't pronounce
it.
Okay. Psoriasis.
All right. It's psoriasis.
Well, why did they put a P in front of it? And if you
like
don't
pneumonia.
Use it?
How do you say pneumonia?
Yeah,
it's
why
P,
did
right?
they put a P? They put a P
That's
before
the English language for you, right?
I don't know.
Okay, so it is psoriasis. And again, like I talked about lasers for acne, we have this great laser for psoriasis. And I have a large psoriasis practice myself. I have a lot of patients. They've been on lots of steroid creams, all kinds of stuff. Now with this laser, it is approved by most medical insurances will cover it.
Oh yeah, insurance?
Yes, insurance will cover it, and it's not dangerous. It doesn't hurt. 3 times a week. Yeah, and I mean, I don't know if you know people like to have psoriasis like that.
Oh, I see. Yeah, okay.
Yeah, I don't know.
In other words, they have it in the breast, they have it in the
hand.
hand.
Everywhere. Sometimes total body, but we do have a wonderful laser that gets rid of, well, at least puts you under control, along with, like, for example, the creams, and they're called biologics. Sometimes we have to give them more severe medications because they're so severe. But again, like I said, we have multiple lasers. That's one of them. And what's so beautiful about it, like I said before, is your insurance will pick it up. And another thing is it doesn't hurt. That's a good
That's
part.
another thing. You know, there's so much advancement as far as pain. I know 8 years ago I had one hip replaced, And then now 8 years later, I had the other one, and I had less pain, hardly any pain. And then I only stayed in the hospital 3 days. And the other time was almost like a week.
I know.
So there's so much advancement. So don't hesitate. Don't hesitate to get it checked out. Especially you got a free, go over there and you check, make a phone call, say, look, I'd like to come in here. Boom, you make an appointment.
That's right.
Stay healthy, enjoy, you know.
And we offer that to the community.
And I say, beautiful skin starts here, okay?
Well,
now,
thank you.
And what else we going to go? What else we got going?
Okay. Well, do you have any questions for me? Or I could get into...
Well, how about if somebody has, how about a boil? What's it? Boils out of style? Years ago, I remember they used to have boils, and they would have they'd get leeches to put leeches on them, draw it out.
Right. Well, we don't quite do that anymore, but yeah, but there are a lot of boils that you probably experienced that when you had severe acne.
Everybody in the block. I lived on Chester Street. Everybody had boils or so.
Hank,
is that something that?
Yeah, a lot. You know, you realize a lot of people they don't believe in going to doctors, and they wait till it gets really bad. Right. So I see a lot of them. They think that sometimes they can treat it by themselves, but then they get really big. It's really what it is an inflamed acne lesion, but it doesn't have to be on your face. It could be anywhere on your body.
Yeah, right.
Yeah, and then you have to get it treated because then it gets really big and nasty.
And how about the people that have a rash? Now, is that
well, that covers
think about cancer, but also about rash.
Well, yeah, that covers
Maybe
all
they're
dermatology.
allergic to some kind of food or something.
Right. Yeah. Sometimes.
I think my sister tells me every time I eat seafood, I swell up or get.
Right.
You know,
well, that's why you got to run. You got to see what's going on. Sometimes it is. So
if somebody comes in with a big rash or so, what do you do?
We have to check them out. And you know, I've been in this business like 20-some years now. I can kind of figure it out. And so it's not good for, you know, to do too many home remedies. I'd give you maybe 4 or 5 days, and not any better. Better get in.
You better check it out.
Because it could be anything from shingles, a rash could be shingles.
Okay, that's another thing. Shingles. What's scoop on that?
Yeah, that's another. It really comes from a herpes virus, but it's a chickenpox virus. Is a herpes virus. Oh. But you know what? I think we're going to be running out of time. I think that's going to be a good one for the next time, because I want to give you a few things for yourself, because I want to give you a couple presents from my store. From my store, and anybody can get these. But I want to give you this because you asked me yesterday at the Living Expo.
Northtown High School, or no, the Northtown Times Herald Expo.
You
yesterday. Had an exhibit there. Right. You had more people around there.
So I said, well, I'll give it to you. So I want to present this to you. It's a facial cleanser, 5%. It'll be great for the oily skin.
Oily skin.
It's very, and you use it every day, and actually keep it in the shower, and it lathers up, and it feels real good, and it's not going to make you like rashy or real dried out.
Won't dry me out, right?
Now, you do have grandkids, right?
Oh, yeah.
All right, there we go. Here's a nice sunscreen for your grandkids. You can put it in their Christmas stocking.
One's a soccer captain of Methacton.
Well, there we go. Oh, well, then maybe that's for babies. So maybe you have a great grandkid, right?
I think he had a little acne. I think he got treated.
All right, now this is a good one, like say if you're out there on the golf course or you're walking or whatever.
I don't play golf.
Or whoever.
I play bingo.
All right, there we go. If you're playing bingo out in the yard, because they're little pads, and they're already sealed. But you take a pad, and it's like the glycolic cleanser that I gave you. You take the pad and you wipe it all around your face. You get the oils off your face.
Take the oil off. It's like a sponge, huh?
Yeah, it's a little pad. It almost looks like a Stridex pad. But that's a good one to keep. Like a lot of the people who bike.
I'm going to be all fancy. I'll be unoiled.
And here's not that you need a growth factor, but the vitamin C has a growth factor in. It's good for your type of skin.
Now what do you do with this?
You put it on your face.
Spray it?
Yeah, just put a little bit on your finger. It comes out like a little foamy thing. And then you put it all over your face. It's going to help the redness, the oiliness.
Oh, yeah?
And it's just a very good, because we all need vitamin C in our bodies. Even topically on our skin. So it's good. So there you go. You're all set up for your skin regimen.
I'm going to go to the dance hall now. Now. All right, now tell me something about yourself now, okay? You're born and raised where?
I'm right here in Norristown.
Norristown. You're born and raised in Norristown, right?
And I stayed in Norristown.
Right. Yeah. And your daughter, what position she have?
She's an assistant. She's got a physician's assistant, PA they call them. And she does everything I do. She does surgeries, and she does the Botox and all that stuff.
Okay. Oh, yeah, now that's another thing. What is that? with the what do they call that? Botox.
Botox. Yeah.
Botox.
Well, if you really want to know, I do just
Go ahead,
have.
tell me,
just,
flash
yeah.
that.
Well, see, look at this. See
I'll
that?
hold them. You explain it.
All right. See, that's before, and
This
we
is,
have.
This is before.
Yeah, before. Yeah.
All right.
And that's after, and that's like a day after, because there's a botulinum toxin called Dysport. There's two. There's Botox A, cosmetic, and then there's Dysport. And if you're going someplace special, like the next day or the day after, you can get Dysport, and all those wrinkles will go away within 24 hours.
No kidding. In other words.
Yeah, those wrinkles
right?
there.
This is before, right?
Yeah,
You
right.
Get that up
That's
there,
a crease in the
and
muscle.
Here it is.
Right, and that's after.
And plain.
And
What's
that's
the
a big
procedure on
part
that?
of my practice. You just come in. You want people get that maybe every 4 to 6 months to relax the muscle. It's a little tiny, tiny injection. Some people say it doesn't even hurt. I do myself. I don't even, I just look in the mirror and do it because I can't walk around with wrinkles, right?
Right. How long does it last? So,
4 to 6 months.
oh, yeah? Mm-hmm. Oh,
Yeah.
okay.
So that's a good one and I do a lot of people with the Botox because that's a very, even in these recession times, people are coming in because they have to look good in the workplace.
Well, let me tell you, when I say that a lot of doctors were born and raised here in Norristown, get that book that just came out by Stan Husky, all about Norristown. And in fact, my picture's in there too, not about boxing. But here's Norristown, the county seat of Montgomery County. You're one of the top dermatologists in the country.
Thank you, sir.
And you're here, born and raised in Norristown and practicing right here in Montgomery County.
Thank you so much.
Thank you. Grazie. Okay. Thank you very much. And ladies and gentlemen, I really thank you for allowing us to come into your home and share this information and hope that, that you will stay beautiful. Okay. I know you're beautiful, but stay beautiful. And check it out too. Don't forget, you can stop and get free screening here at her office every Tuesday, right? Every Tuesday from 9 a.m. to 11. And 610-277-2663. And free cancer screening. Ladies and gentlemen, till we meet again.
Thank you.
God bless you, each and every one. And here's for you. And then we say,
ciao.
Alla salud means to your health, good health and happiness. Thank you.